Physicians who prescribe controlled substances like opioids are going to get patients in their office who are drug seeking, who are doctor shoppers. They have the golden pen, so to speak. So this is where the patients, or they're not really patients, they're drug seekers come. So clinicians need a strategy to manage these patients. We've already talked about screening, prescription monitoring, making sure that you're the only doctor writing for these classes of medicines. See where your patients are getting their medicines. See where they're getting their medicines filled. Urine toxicology screening is invaluable. You need to know if your patients are using illicit drugs. You need to know if there's opioids in their system other than what you've been prescribing for them. So you need to be able to identify these doctor shoppers. Oftentimes someone in the waiting room will say, hey, that last patient offered to sell me his drug, or you'll get a call from a friend or a family member telling you that the patient is doing something wrong with their medications. You need to confront them. Sometimes we get law enforcement involved, even though it's very difficult, because in order for them to be prosecuted, they have to be caught in a crime. We can't just call the police and say, hey, this guy's doctor shopping. And there are certain confidentiality rules that go along with disseminating information about patients that might have a substance abuse problem. So it becomes a very challenging issue. The number one important thing is for clinicians to monitor their patients with some of these new tools to get an idea of who might not really be patients, but yet drug diverters in the long run.